Hey guys, my name's Sam and welcome to Prep Medic. This week we are talking infant CPR. All right, a couple disclaimers before we get started with the video. Number one, working with an infant is very distracting. This is a very high fidelity simulation mannequin. Took about 9 months to make. Number two, medical information changes over time. So if you're watching this video at any point after when I recorded it, which is all of you, there is a chance that the medical science has changed and current recommendations have changed. All of the information in this video is accurate to my knowledge, but I have been known to get things wrong before, so it's very important that you go take a card class either through the American Heart Association or the Red Cross. With all of that being said, let's get into the video. All right, so today we are talking about infant CPR, which is basic life support for children under the age of 1, but over the age of 1 month. This is Oliver, he's my son, obviously, and he is about 2 months old at this point of time. So I figured this would be a great time to do this video. The first thing we're going to be talking about is cardiopulmonary arrest. So that's when we're going to be doing CPR on children. Now, this is a very rare occurrence. And no, before you guys start commenting and start reporting me for child abuse, I'm not actually going to do CPR on Oliver. I don't have a good training mannequin for infants, so I can demonstrate this in some other ways that won't actually hurt this little guy. So number one, we're looking for the signs to start CPR, and that for the layperson is going to be a child who is not breathing or not breathing effectively, so they might grunt, that's called an agonal respiration, and is unresponsive. So as we come up to an infant that is unresponsive, we're going to tap and shout. So we're going to tap the bottom of their foot and we're gonna yell, "Baby, baby, are you okay?" We want to stimulate them. So if they are alive, just sleeping or in a somnolent state from another medical condition, we want to get a rise out of them. A crying baby is a good baby. So I come up to Oliver and I say, "Baby, baby, baby, are you okay?" And we're gonna pretend he's flaccid. I'm going to look at his chest and see if he's breathing. Now it's a lot easier if you take off whatever the covering they're wearing is, so you can actually visualize the chest, and you'll be able to actually see him breathing on his chest, and we can see that pretty easily. So we've got some tummy breathing here, we've got breathing. He doesn't have retractions, he's not using a ton of accessory muscles, which is great. But we're tapping, we're looking to see if he's breathing, and he's not breathing, and he's not moving at all. So the next step here, we get this under him so he doesn't get super mad, is going to be positioned for CPR. So I wanna get somebody getting help. So you go get help, or if I have a cell phone, I can take that out, put that on speakerphone, and I'm going to get an ambulance coming, because CPR is just a sustainment measure. Most of the time, it's not going to actually resuscitate somebody right there without electricity or other interventions. The next thing I want to do is I want to identify the landmarks on the baby. So for a baby, we're gonna find the nipple line right here, and I'm gonna put my top finger just under the nipple line, the other finger right above that, and I'm going to compress down 1/3 the diameter of the chest. So on Oliver, we can see we're gonna be compressing almost that much. So we're gonna come down, and that seems like a really deep compression. However, that's what's gonna help the heartbeat. Now, while this does cause some internal injuries, they're not serious and they will not cause the baby any long-term harm. So we're going to start compressions, and we're gonna do that 30 times. So if I have like a towel, we'll just pretend I'm doing CPR right here. We're gonna go 1, 2, 3, 4, 5, 6, 7, 8, all the way up to 30. We're then going to take the airway and we're going to move this. So I don't wanna do a head tilt chin lift too big. Babies' airways are relatively small and they can kink off. You can see while Oliver is laying down, I think you can see it on this camera, see how his head is pretty big. Now granted, he's got a big head for a baby anyways, but one thing that can happen is they'll actually kink it off, and you can put something behind their shoulders, and that's going to put them in what's called a sniffing position. So a neutral, inline position to open that airway. And I'm just gonna slowly turn up the chin. I'm gonna take my mouth and make a seal over the nose and mouth, and I'm gonna breathe twice. So 1/1000, 1/1000. And I'm just breathing in until I see the chest rise. Babies have very, very small lungs, so obviously this isn't something I need to do excessively, or we might cause some barotrauma, some overexpansion of those lungs. So we're gonna go 30 to 2. If I get a second rescuer with me or somebody else that can do CPR, we're gonna transition. So one person's gonna be at the head doing breaths. The other person is gonna come along the baby like this and take their thumbs, put them in the exact same position the fingers were, and we're gonna do basically a downward push with our thumbs to do CPR. So looking at this blanket that I put under him, sorry Oliver, we can take that and we're gonna take this right here and go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Once we hit 15, they're going to give the 2 breaths and we're going to do 15 again. When we're just one rescuer, we don't want to be delaying it by doing all of these transitions back and forth. That's why we're doing that 30 to 2 for babies. All right, so moving on to the next part of this, we're gonna talk about choking. Now, Oliver here is 2 months old, so his risk of choking is not very high simply because he's not at the point where he's grabbing things, putting things in his mouth. If a baby is choking and they're below the age where they can actually handle things, there might be something else going on. So just keep that in mind. Now, once he gets a little bit older, we start getting in that 6, 7, 8 month range. He's gonna be picking things up and he might pick up, a Lego or Werther's whatever, put it in his mouth, or you're just feeding him peas or something, who knows? And he might start choking, and we have to be able to perform basically the baby version of the Heimlich. And it's very, very similar to CPR. So for this, we're gonna do the same thing. Baby won't be making any noise. Gotta lower this desk just a little bit here to actually make this work. Bye, Oliver. In these cases, we're gonna take the baby. They're not gonna be making any noise. If they're making noise, you have stridorous respirations, which means you have this really high-pitched whine. We're going to call 911, but we're not going to do this maneuver until they've stopped making noise and they're not breathing, because that is a sign it's a complete airway obstruction. And the only thing we can do here is help. So the first step here is we're gonna hold them, and we're gonna hold them pretty securely with our hands, kind of like a football. We're gonna take this, we're gonna do 5 compressions. We're then gonna take them, we're gonna hold them just like this. We're gonna move them over, and we're gonna give them 5 back blows. 1, 2, 3, 4, 5. These are very forceful and we want their head tilted down. We're going to continue going both ways until that obstruction clears. As they're on their back, you can also kind of look in their mouth. If you see what was causing the obstruction, you can grab it, but never ever do a blind finger sweep. You might push it farther than you can actually retrieve. So once again, that's gonna be 5 compressions like this. You're gonna hold them like a football. Support that head always. 1, 2, 3, 4, 5. Grab them like this. Don't poke out their eyes. Support their head with your other hand and do 1, 2, 3, 4, 5. And just to demonstrate kind of the forcefulness of those back blows, it's 1, 2, 3, 4, 5. All right, guys, so I hope this video was informative, if not entertaining. Like I said in the beginning of this video, this is not a replacement for card classes, medical information changes, and I'm just some guy on the internet, so it's not a replacement for an in-person class. If you have any questions, leave them in the comments down below, and I will see you next week.